My name is Maria Richardson, and I'm going to talk for about 10 minutes today about my experience as a patient with HCC surveillance. I'll talk a bit about my own medical history, talk about the surveillance that I have had, and then I'll finish with 3 points, which will be sort of points for clinicians, things that my clinicians have done for me during this surveillance that has just made such a positive difference to me as a patient. So first of all, a bit about my medical history. I was diagnosed with ulcerative colitis when I was a teenager. Routine tests for that picked up elevated LFTs. After they'd established I wasn't an alcoholic or a drug taker, I was diagnosed with primary sclerosing cholangitis in my 20s. Since then, my disease has progressed. I'm at the stage where I've just started to have compensated cirrhosis. Obviously, I'm aware as a PSC patient that I am at an increased risk of a number of aggressive cancers, and HCC is one of those. I am fortunate that I am seen at King's. I've got a great team there, and I am routinely monitored for HCC. Probably since my diagnosis, I've had well over 25 ultrasounds, the same number of MRIs or MRCPs. And I suppose my sort of bottom line is my preference is, as a patient, to have all this extra surveillance where I can have it. If it's a non-invasive test that will give me some surveillance benefit, then yes, I'd like to have it. Even though the tests, of course, they do cause anxiety. And certainly with an ultrasound scan, I have had a scare where there was a false positive, I think you call it, where a lesion was overestimated, and a subsequent MRI put my mind at rest. In 2021, I had my first HCC scare, so that was the first time that cancer was mentioned to me. That was probably, and that period of all those tests was probably the most stressful time of my life, or one of them. They'd found multiple lesions that were growing, and I think what really concerned them was the rate of growth. So I had my MRI with contrast injection, CT, PET scan, went on to have a liver biopsy. And ultimately the result was, I think the biopsy report said there's no convincing characteristics of HCC. But since then I have continued to be monitored. Something that made that process really more stressful for me, and a big frustration that I had, was the time it took to have these tests. I'm aware that there's a target, the 2-week target from the point that a test is requested to the test being done. But what I hadn't appreciated was all the time it took in between before the next test in those series could be triggered. So the time taken for the radiographer to produce his report, then it had to be discussed at an MDT. I wouldn't know when the MDT was taking place. I wouldn't even know if I was on the list for the next MDT, because I knew that could change at short notice. And then the next test has to be requested. So that for me was a really stressful time that I felt took a lot longer than it should have done. During that time, obviously, I felt completely out of control. And I was also concerned that, I turned to Google. I thought, right, if this is cancer, I'd be looking at a liver transplant as a possible treatment, but that's only an option if my lesions remain within a certain size. So here I am with some lesions that are growing very quickly. Is my potential lifeline going to be taken away from me because of all this delay? And the latest update is, so I've had 6 monthly MRIs. Again, one of the lesions has started to grow, causing some concern. So I'm back on that surveillance route again at the moment. Turning to the second part of my talk, which is about things that clinicians have done that have made a really positive difference to me. I've got 3 points here, and the first one is having a clear surveillance plan, one that the patient knows about. If this can be ideally put at the top of letters that are sent to the GP, so the GP is aware as well. I have gone to appointments where a registrar that I've not met before has been there, and they've asked me, what's your surveillance plan? I can't see it on the file. and I've said, oh, it's either 3 months or 6 months, I feel like I'm overdue a scan, and they had to refer that back to the MDT to get clarity on what that was before that test was scheduled. So to me, that just caused a lot of potentially avoidable anxiety. And of course, the tests should take place when they're meant to take place. The second point is, as a patient, we should really know who to contact, and please have an alternative contact because everyone goes on holiday. Particularly so now results are published online, so I might get a ping on my phone, your results are available via this online portal, and if you've got no one to discuss them with, put them into context, that can be really, really stressful. Or if I've developed a new symptom, so if I've become jaundice, who do I tell about that? You know, because I think that's relevant. And my third point is, where possible, if you can pick up the phone or have an appointment with your patient, you know, just speaking to them in person can really reduce the level of patient anxiety. Pam this morning referred to clinicians as demigods, and you really are. To us as the patient, you are a demigod. You have our life in your hands, and to be able to speak to you and have that result put in context makes all the difference. And to talk about a recent example, I got a letter through for another test that was outside the normal schedule of my surveillance plan. So of course I thought, oh gosh, this means something has come up in my previous scan. I hadn't had the results of that scan yet, so I'm putting 2 and 2 together, getting very anxious. I was able to reach out to my medical team. One of the doctors called me within a few days, and he spoke to me about my results, explained why this test was needed, and he was able to explain, you know, jargon like what the LIRAD scoring system is, and it meant that when I did then receive the report online of my previous MRI, I knew what to expect. I mean, it just made so much difference, saved me sleepless nights, and I was really grateful for that. So just in summary, obviously being tested for any cancer is very stressful, particularly considering what, you know, I've been hearing today about the poor prognosis for HCC. But as clinicians, you really can make a real difference to the patient. Having that open channel of communication, having that clear surveillance plan, and trying to avoid unnecessary delays really does mean the world to us as patients. So that's it, and I just wanted to say thank you to everybody here for helping to improve the standard of liver care for patients like me. Thank you.